about the entry of a child of 1 year to 3 years of age into your dental clinic. Now this is the stage of the deciduous dentition, or we can say the primary dentition stage of a child. So what are the related issues or what we can expect when a child of 1 year to 3 years enters your dental clinic? So this is our topic, and how we can proceed with the child and what are the things that we should be knowing about the management of the child at this particular age group when there are deciduous or milk teeth in the child. Now first we should look for the most common things or the purpose of visit of parents, or we can properly say that the chief complaint. So the issues that are most commonly referred to are there are either no teeth in the oral cavity, like the child is 1 year of age, but the parents are worried that their siblings, the child's siblings, were having the teeth at this particular age and this child does not have the teeth. So these are some of the important concerns. Or there might be teething issues, that there is excessive salivation or the child is continuously irritated, he or she is continuously crying. It was not before, but when the teeth are erupting, it is there that there is continuous irritation in the child. The child is skipping his or her food, is not having any food. So these are some of the issues that you should be aware of. Now there might be eruption cyst or eruption hematoma that parents would be referring to it as a swelling, or there is bluish swelling in the oral cavity where the tooth must get erupted. So you should be aware of that these might be the eruption cyst or the hematoma. Or there might be first dental visit, just a regular or routine checkup by the parents, so that because this is a milestone, great milestone in children, and they are excited and they want to know that everything is correct or not. So this might be the issues. Or there might be the traumatic injuries that the erupting related to the erupting tooth that has occurred, and there might be soft tissue injuries, the child has fallen or the tooth has broken. So this must also be kept in mind. Okay, then there might be tooth decay for a 2 year or 1 year, 1.5 year old child, or 2 or 3 year old child. There might be discoloration or decay or the cavity in the tooth that you must be aware of, that this must be dental caries, and how deep and how you have to diagnose that dental caries. There might be missing teeth, so you should be aware of the chronology of the eruption of primary teeth, so that you can make out if some teeth in that stage that is missing there, so you can easily evaluate or go for a proper diagnosis or evaluation of x-rays or diagnostic IOPs or the OPGs. Okay, there might be dirty teeth. The patients might be complaining that we keep or telling, or we keep guiding about the brushing, we properly brush his or her teeth, the child's teeth, but still there is no cleaning of the teeth are completely yellow, or there is lot of debris on the teeth. So you must be aware of that the proper oral hygiene is not being maintained, or the proper brushing technique is not being maintained. The other thing that you can focus on is there might be mobility related issues with the teeth, that the child had a history of fall and the tooth is mobile. So these must be some of the things that you must be aware of and are most common things while the parents are reporting at your dental operatory with these type of chief complaints. Okay, now how we can proceed. Okay, now you have to look for, if the child is relatively small, like 1 year child is relatively small, such that you can go for a knee to knee examination, where you can sit as a doctor and in front of you either of the parents can sit joining the knees together, and the head of the child can be towards you. So this is the knee to knee examination, only to be used when the child is relatively small. If the child is quite big, but for the dental chair he or she is not that big, so you can go with the child on the parent's lap and then the parent sitting on the dental chair. So these are the two important steps that you can look for before proceeding with any other examination. Now when you have to begin with the oral examination based on the chief complaint, okay, first thing, beginning with the oral examination, you should not overlook about the child abuse, and this is especially related to the girl's child. So you should, anything, any physical, any emotional things, the child is not concentrating towards you, or the child is continuously crying, maybe a 3-year-old child has a physical injury, so these type of things should create suspicion amongst you that the child might be abused. Okay, after that you can proceed with the examination, that is the oral examination. So you should look for the teeth, number of teeth, their chronological appearance, that whether the child is, suppose the child is 1.5 years age or 2 years of age, so all his incisors, that is the central incisors, the lower ones and the upper incisors, must have got erupted. Okay, now the shape of the teeth, you must be aware of the normal size and shape of primary teeth. That's why we do the carvings in our undergraduate curriculum, so that if there is any developmental anomalies, in such cases we can get a proper diagnosis that some issues might be there. For example, peg shaped lateral is an indicative of sickle cell anemia disease. So these are the some of the important things that you should be aware of. Okay, now there must be eruption sequence issues, the child or the parents are complaining of missing teeth, so you must be aware of the eruption sequence. Okay, so you should look for that. Then any soft tissues anomaly, for example, the soft tissues anomaly can be related to a newborn child, or a 1-year child mostly have the oral thrush or the candidiasis infections, or there might be ulcers or ulcerations due to sharp teeth that is injuring the soft tissues, so these must be looked upon. Now there might be also the presence of white spot lesions. Now this must not be the chief complaint, but this should be looked by you as a dentist, because this is the thing that the oral hygiene is not being maintained, or there is lot of exposure to the sugary food that has created the initial lesions, or we can say the white spot lesions. Now these type of lesions will lead to the development or progression of caries at a later stage, and in spite of parents reporting you at a proper time, that is 1 year of age, still the caries develop at 2 years of age, would decline your credibility as a dentist. So you should be aware of these things, and you should identify and then advise the parents about the different preventive protocols. Again, there might be caries development that the parents have reported. There might be the pit caries, or there might be deep caries associated with swelling 2.5 or 3 years of age of a child. So you should be aware of these things, how different types of caries are there, how you have to classify these. So these are the things that you should be aware of. Then you should look for the diagnostic X-rays. Most importantly, go for the IOPAs, as at this stage the child might not be very cooperative for going towards OPG. But in case of delayed eruption cases where the teeth have not erupted, so you should go for the OPG to identify whether there are developing tooth buds there. If there is a case of complete endodontia, you should get an OPG done. So these are the issues that you should, while looking at the oral cavity, you should be aware of all these aspects of the sequence of eruptions, shape, congenital anomalies. All these things you should create, or you should be aware of. Now when you have identified these things according to the chief complaint, you have to proceed towards the management. How you can proceed towards the management is that resolve immediate issues, like there is swelling associated with the teeth, with that particular tooth due to deep caries, then that must be accompanied by immediate access opening, or the treatment that you plan to do, or you might plan to do extraction of that tooth because of grossly carious tooth, or you can proceed with the medications. That is most importantly advised. Then do not neglect about the white spot lesions that you have identified. Go for the preventive approach, fluoride applications, advise tooth moles to the parents, or you can go for sealing of those pits with help of normal GIC restorations, glass ionomer restorations. Okay, definitely include the follow-up by the next week, so that you can go for further restorations or the further treatment of the child with an immediate follow-up, and this would create a good credibility of you as a doctor. Now apart from this, when you are done with all these things about management, you should always advise about the proper oral hygiene instructions. Whether the parents know or not know, you should advise them the proper oral hygiene instructions with the help of a model and a model toothbrush, so that dummy toothbrush, so that the proper oral hygiene maintenance will build up your credibility, will help the parents about what they might lack and how many times they might brush, how they can properly evaluate their child's oral cavity and maintain the child's oral hygiene. So this is some of the important thing. Now also you should advise about the diet counseling, because at this stage the child is he or she is in the process of weaning of diet, that is the expansion of diet, right from the milk to the semi-solid and the solid food. So the proper diet counseling at this stage and reduction in the sugar exposure will help in the less progression of dental caries, and this would be a good part on your when you get the follow-up of the parents. So this creates a good belief towards you as a dentist. So these are some of the important things based on the reporting of the child from 1 year to 3 years of age at your dental operatory. Hope you got the points about these steps and you can follow it easily. Thanks for watching this video. Bye bye. Take care.